'tis the season for special guests on Hope, Power, and Healthcare. So we got Chris Hemphill and
Melissa Reilly.
and who else on here?
Terry Tuznik.
Terry. So Terry has a deep background. We're going to get into why she's joining us on the show in a second. But Terry, would you mind giving a quick introduction? Or I can't even say quick introduction because you've done so much. Could you tell us about yourself?
Sure. So I am started off my career as an RN in critical care, and for some reason, I think it was to escape a boy, I decided to join the Navy to get out of town. It was
that
like
is
my French
dramatic,
Foreign Legion.
Terry.
I know.
There's
it really
a story
was.
there.
And so I joined the United States Navy, where I worked at Naval Hospital San Diego in the 80s, and stayed in as a reservist. So I got out of the reserves actually right before 9/11 as a lieutenant commander in the Navy Nurse Corps. So I really loved my time doing that. But I had really, while I was in the Navy, we implemented a system called CliniComp for the critical care, ER, and labor and delivery units. And so when I was seeing how technology really changed, the way that we delivered patient care and how it made it safer and better, when I got out of the Navy, I went back to my civilian hospital here in Phoenix, Arizona, St. Joseph's Hospital, and I became the director of clinical systems because they decided it was easier to make a nurse an IT person versus making an IT person understand all the nuances of the clinical world. So then after I left there, I went to work in sales and marketing for that CliniComp product that I mentioned, and I did that for a while. Then moved to Tucson, Arizona, and I was VP of new products for a company called SunQuest, primarily known as a lab company, but at that time really could have been the next Cerner or Epic, because we started developing an EHR pretty early, but we were doing it piecemeal and not really looking at a fully integrated system. And I kept arguing with our owner that that's not going to work. That's not the way to do it. Then I moved into the consulting world with IBM, and I was there for a long time, primarily working with payers. So it was great to learn the other side of the world from where I'd been. Went to GE Healthcare, Accenture, worked at a startup with Chris, and then I find myself today where I'm out now on a medical leave from Nordic Global, where I'm doing solution executive. So I'm working around all of the different solutions that Nordic brings to the table. So I've been out on medical leave, though, the last 5 months. So I'm looking at my clock ticking down, and I'll be going back to work, I hope, at the end of this month.
Incredible.
So was that a good abbreviated version, Chris?
That was great. Well, Chris, I have a question for you, right? So at Hope, Power, and Healthcare, we are always trying to inspire the fam. What made you want to bring Terry on this week?
Gosh, I want everybody to take lessons and take notes. I hope you're already taking notes with Terry's transition and journey and using that clinical knowledge in that data and IT sense. Take that as
and leaving the country because of a boy. Like that is quality advice. I'm gonna use that one somewhere with my daughter maybe. If the boy bothers you, just go.
But Terry and I have been friends for years, but on we followed each other on TikTok, and she mentioned her medical leave, and she has been sharing very openly about her dealings and frustrations and highlights with the medical system. In addition to that, Terry, if you wouldn't mind turning that camera to the medals. She has also been sharing about something I'm very passionate about, running. Look at all that work, all those medals, and even on medical leave, even out, like I was like just blown away by what you were doing at like doing the Disney marathons and things like that. So we want to be that fuel and inspiration for people that are dealing with, like, we have a difficult business climate and funding climate and political climate, but there's also the things that happen within ourselves. And Terry just wanted to just bring you on and just have a conversation with you about life and what it's taught you, and just give people that inspiration if they're dealing with some significant challenges like that.
Well, thanks for having me on, Chris. I hope I live up to that.
Well, I would love, so I'm a reluctant TikToker. I
Wait a minute,
TikTok because,
did I even describe? I'm sorry. Did I even say it was specifically dealing with the can't, like, we can edit it if we need to, but
oh no,
the,
you said it. You
oh,
said
I
it.
said
And
it.
that
Okay.
part, so as a thyroid cancer survivor, like, I where I was going to go was exactly to this, is that, okay, for those of us that are reluctantly TikToking only to follow their children and what their children are up to on the TikTok, Terry, can you give us a sense of maybe some of what you've been sharing on TikTok and what inspired you to take to that platform to share?
Sure. So, and I'm sharing also on all my social media channels, and I'll start with that, and then I can share my journey. The reason that
Yeah,
I
tell us your
decided to
handle
be
too. So yeah, tell us your
oh,
handle so we can
absolutely.
follow
Well,
you.
it's Terry's Cancer Journey on TikTok, and then I'm T Tuznik on, and then Terry Tuznik on Facebook and Instagram. T Tuznik on Instagram.
Awesome.
But I decided to share because over the past 5 years, I have lost seven really of my closest friends. It's been a horrible time from cancer. A couple of them were pretty public about it, and and I saw everybody jump in and help. And one of them I found out the day before she passed away, when her husband said, she's in hospice, if you want to see her, go, because she's not going to be around very much. And I did not want, if I was diagnosed with ovarian stage 3C cancer on September 30th of this year, or last year. I had no idea that I was sick, but all I knew was I didn't know if I was going to survive this. I knew I was going to have a massive surgery because the cancer had spread everywhere. I'm very, very grateful that it wasn't stage 4, but I wanted to make sure that the people that I cared about and the people who cared about me knew where I was at, what was going on in my life. And, I've always been somebody who likes to be the giver. And this was the time where I had to learn how to be the receiver. And that's been really difficult for me. But I have really learned to kind of, and sometimes those of us that are the givers, and it does come from our heart, but part of it's also pride. So I had to kind of let that pride down to be able to receive the help that people gave me. So my journey really was September 30th. I had some abdominal pain for maybe 2 days. And I won't name health systems here, by the way. I'm going to call them health system A and B, if that's okay, because
That's
they
fine.
still could be clients, and I'm still actively involved with one of them. Because I also want to share they're very different health systems, and the care has been interesting and good and bad in both. So it's been kind of fun. But anyway, I walked into that hospital not knowing I'd had this abdominal pain for a couple of days. And I'm going to say this, I felt like I got lucky because I started at urgent care and I had a female PA who said, something feels off about you. I'm going to send you to the ER. I'm going to call them and tell them that you're coming. So we got to the ER. I didn't have to wait too long. And when I got to the ER, I had a female nurse practitioner who took me seriously when I said, now honestly, I didn't think it was anything. I had been under GLP-1, so I thought, well, maybe this is constipation or some type of a GI upset, or maybe pancreatitis from the GLP-1s, because those are all common side effects. And then to find out when the nurse practitioner came in, so she ordered the right scan. She ordered an abdominal and a chest CT. And when she came in with tears in her eyes saying, I have terrible news, and you have advanced, and at the time she said it could be stage 4 ovarian cancer. That was
Wow.
a shock. Like, no idea. woke up September 30th, took a couple meetings at work until people pestered me enough to go to the urgent care because I kind of was wincing a little bit. And they're like, what's wrong? But no idea. Hospital A is where I started this journey. And so they did some additional tests. I didn't see an oncologist for a few days, but the oncologist that I initially saw was would say he would schedule something and then never schedule it. Did not build trust in me at all. And I am very fortunate in that that someone that Chris and I used to work with, Veronica Campbell from a different health system, is connected to every doctor in Phoenix. But again, see, I'm lucky. I know the right people
You're in the
to
system.
call.
Yeah.
Other people don't. But I immediately got a second, third, and fourth opinion scheduled.
Same. Yeah. My
And
journey
so
too.
I felt really lucky because I think so many people would be in the situation where you have this oncologist that did not engender any trust at all because he kept breaking my trust. And he seemed genuinely surprised when after they finally did a biopsy, which he didn't order, his nurse practitioner ordered because I kept myself NPO because he was supposed to order it. So I was checking out because I told the hospitalist I need to go find other opinions, and he seemed genuinely surprised when he came in, like, well, you're not going to come see me. It's like, no. The other scary thing about care in the entire state, there are only 13 gynecological cancer doctors. Only 13 in the entire state, and one of them was not someone I wanted to deal with. So again, thanks to Veronica, I got the connection with two others, and then I got a call out to Hospital B, we'll just call it that, where they actually get to pick their patients, and they picked me. So then I had a pretty massive surgery where they removed quite a lot of things, and that was at Health System B. And I will say care there was pretty good, but no one bothered to get me out of bed until my daughter came back from her honeymoon and did that. So,
Wow.
several days later. So it's been an adventure.
And Terry, did
I'll
you
kind of
find that
pause.
your expectations of the journey were managed? So did Hospital A, Hospital B, did they give you a sense of what you would be facing? And I did a lot of work in like caregiving products, and did you have a trusted person with you to help you understand all these different options? Because I think a lot of the research says that when one is faced with a shocking thing to your system, you don't process as well. You're in shock a little bit. And so how did that experience manifest for you?
So it happened at such a terrible time, and so my daughter, the day that she took me to the emergency room at Hospital A, was actually headed out of town to go get married because they eloped to New York, and then they had a
Oh,
honeymoon for 2 weeks. She is an RN as well. Would have been great had she been there,
yeah.
but but she already had this scheduled, and so even from the hospital I said no. But my sister did come along with me to kind of bounce off, and went with me to all of the different physicians that and I felt like, it's like I told the doctor at Hospital A, the oncologist I didn't like, this is like dating, and I'm going to find who I'm going to marry, because we're going
Yeah.
to be in a relationship for
This
a
is a
while,
bad match.
and this is not the match for me. And he still, I'm sure he's like, I don't understand why that woman didn't. But yes, so that was really helpful that I had my sister. So I always had someone, to the appointments, like, did you hear this? And I will say, so at Hospital B, we met the surgeon first. So there's two ways to deal with ovarian cancer. They can either do chemo or and then do surgery,
Hmm.
or do, like part of the chemo then surgery, or you can have the surgery and then do all the chemo. The difference being, if it's not too aggressive, they have the luxury of being able to do the chemo, and if it doesn't work, then they can kind of figure that out. Well, my cancer was so aggressive that a second tumor had grown on my spleen in a week.
Oh
So the
man.
surgeon actually, and I will say this for hospital B, for doctor communication, I had a CT scan at that hospital. Within 30 minutes, I was still driving home. This doctor, well, I will tell you her name, Dr. Delark. She was fabulous. She actually called me in my car to say, this is really aggressive, and I think you need to have the surgery first because you don't have the luxury of chemotherapy not working, and you need to have this surgery right away. I felt a lot of assurance from her. So I had this massive surgery, came home, and I was going to have a few weeks before I got ready to meet the oncologist to have. Well, I came home and I proceeded the day after I came home to almost hemorrhage to death.
Oh
So
no.
I ended up taking an ambulance ride back to Hospital A because it's closer to my house, and did not have a good ER experience there because a lot of disbelief that I would be in so much pain. And even though I came in on an ambulance and my blood pressure in the ambulance was 42/20. So anyway, they did discover I was hemorrhaging. It kind of changed their tone. And I ended up receiving like 10 units of blood. I mean, it was very, I was in critical care for a few days. So got out of there and then ended up back at Hospital B to meet my oncologist, and that did not go well either. So I don't know what it is with me and oncologist, the initial oncologist I saw there, but I also really needed more blood and some other things. So my surgeon had me meet her team in the ER, and I ended up spending another 9 days. So I spent, I don't know, like 25 days in the hospital between October 15th and November 15th. So it was a lot of hospital days. It was really interesting because you see so many things as the patient that you're like, you know.
When you build the systems, you don't get the member view all the time.
Yeah.
I've got
And it is so interesting because some people follow the right way and some don't. And sometimes it's okay and sometimes it's not. And, I try not to disclose that I'm a nurse or that my daughter's a nurse. But we do, eventually say something if we have to. And when I get, are you a doctor? It's like, no, I'm a nurse. And I'm, I know the right way to do things. Thank you.
When like you're giving us that high level view of the ups and downs of the care that you've received and the conversations that you've had after that, and I've just got to talk about how heart-wrenching it was for me seeing like my friend on TikTok, like the algorithm found those, like we didn't have like a prior conversation, it put those in front of me, and I saw you sharing a side of yourself that I had never seen before, and that's just been powerful. It's been definitely been on my mind when I think about the work that we're doing in healthcare. But to me, it's challenging to even get on and, like, even on a good day, get on and record and send a video and things like that. So what is the inspiration? Like, how do you keep yourself going to share this experience? And like, what are you hoping that people learn and do as they follow your journey?
Well, a couple things. So I'm going to share this because it just happened yesterday. I just finished and got my certificate. I finished last week, but I got my certificate yesterday I'm in the Gaja Collective life coaching program. So part of it is just trying to inspire people to understand that there are really hard things in life. But looking back at the why did this, because I did that a little bit. Why is this happening to me? What did I do to cause this? And instead of focusing on that, I'm focusing on what am I going to do in my future? How am I going to stay healthy? What am you need to look forward, not back. And part of that was I wanted to inspire people to know there's really tough things that happen in your life that you don't have to be afraid of. You just got to get through it. You've got to take the advice that comes that's good. And sometimes you have to say, no, that's not for me. I mean, by the way, when I got diagnosed, you would be amazed at the people who came forward with, ivermectin and all types of different things. And it's like, listen, I'm going to listen to my oncologist and whatever, so I am definitely doing my treatment in traditional medicine. But when I move forward, I'm into wellness as well. I'm also a health coach. So I don't know, Chris, if you knew that, but through the Integrated Institute of Nutrition. So I had completed these 2 coaching programs over the last 2 years because that's ultimately what I want to do. I want to coach people to help them, to inspire them to find their answers within themselves. But, so I know a lot of the things that I need to do to maybe get the inflammation out as I move forward. I'm into red light therapy, all these different things. And I find they really are really helpful. So that's my, I do what I can now under the guidance of my oncologist, but I'm kind of looking at, this is a chronic illness I'm going to have to be monitored for, but I'm going to live the best, healthiest life that I can when I get out of this, utilizing the tools that I have, and really go from there. And I don't know if I totally answered your question. I think I did, but I don't know.
Knocked it out of the park. And
chemo brain.
I just realized I've been getting free coaching for the times for the years that we were coworkers. Melissa, you look like you had.
Yeah, I'm. The kids are coming home, so it's always chaos here, and the dogs are going. But Terry, I think you alluded to this before, but one of the key moments that we always love to push on a little bit is that the change, that moment of change, the activation moment, when you picked up the mic for the first time, or you uploaded the video to the TikTok or the Facebook or wherever. What was in your head? Like, what was there a moment that you're like, I'm gonna put this out here?
It's funny that you asked me that, because that friend of mine that I mentioned who'd been in the hospice situation, it was there on the campus of Health System B. So and it still makes me very teary-eyed. I was there and I had gone for my appointment and I knew that I had selected my surgeon. But I always, every time I go there, I almost feel her presence, because I spent several hours with her, and she passed away maybe 3-4 hours after I left that night. And I just thought, I'm not going to be Tara. I'm not going to be Tara. I don't want to just be gone. I don't want people to not know, because she was such a vibrant, wonderful human being, and she died so quietly and no one knew. And she had such joy. And so I decided at that moment, I'm going to share my story. And that was before my surgery or everything. I think that's the first video I have out on TikTok, which is, I'm here at Hospital B and this is what's going on. And I'm not real sure, when surgery and things will happen, but, here we are. I don't know, Chris, did I share about I also had a big payer issue because Hospital
We were on the
B
provider
submitted
side. We
me
only
as an
discussed the provider side
outpatient
so far.
surgery. What was that? I'm sorry, Chris.
I said, I guess we've only discussed the provider side so far, but yeah, please feel free to share the payer.
Well, Hospital
part.
B submitted this massive surgery as an outpatient. And needless to say, it was not. So I got denied. So my surgery was supposed to be Wednesday. So I left Hospital A, then I had that week to go do all my extra tests and all the other things. So, we needed to get this out. I think I told you, very aggressive cancer, already a tumor, second tumor on my spleen. So I didn't have weeks to muck around with this. We needed to get this out. So I get a call from Hospital B saying, hey, insurance denied this, but you just signed that you're going to be financially responsible, and we'll hope they, and I have a cousin who's a billing manager at a different health system, and she said, never do that, because they don't have to pay at that point if they don't want to. Now, I probably would have fought that. But needless to say, because I know enough about, called my insurance company at the right place and said, listen, I know you don't normally talk to the patient, but I really need some help here. I'm going to die if I have to wait another few weeks. I mean, this is how serious this is. And I was crying, and needless to say, the next morning, and so the person said, hey, we have three business days to get back to hospital B, but we will escalate this for you. So the next morning they called thinking they were calling hospital B, and they said, okay, well, your patient is approved. And I said, well, I'm the patient, so can you please call this number and tell them? And they were like, oh, we thought you were the hospital. So
Look
that
at
was
you,
very
care
scary.
navigating. Yeah.
But that's the problem. You should not have to have knowledge of providers and payers to get good care. What is with that? And I will tell you, in my experience in dealing with my mom who had chronic congestive heart failure and heart issues, so many times, because I knew who to call in a hospital or who to call at a payer, we got the care that she needed. But it shouldn't be this difficult.
Yeah, it's so crazy. Like, my mom is a nurse, and I always reflect on, like, what's the type of care that my family receives. And we come from a big family. She's one of 15 brothers and sisters, so she answers a lot of questions. But there's a big difference between the type of care and access that they would have without her in the picture. And I think that's an unfortunate way to be privileged.
My mom was a medical biller. So you can't even imagine the arguments we've had about healthcare and coding and, let's just say the disincentives that are built into the system. It's just, Terry, I agree with you 1,000%. I'm super fortunate, I guess, in our family. Like, my dad was just diagnosed with a cancer, and he's got my mom. And don't you know, Chris, you will love this. My mom at 75, has built a chat GPT to manage my dad's cancer. She uploads his file. She's checking the diagnosis. She's running the bills through it, and it makes you think, those of us that are systems people and systems builder, that, yeah, the system is very broken.
I only got to talk to your mom for a few minutes, but I love her. And honestly,
she'll listen
I'm
to
gonna
this.
say
Yeah.
something that she did reflected in you, because you're one of the most positive people that I know when you're overcoming challenges. I wonder if I can ask you a question about that, which is your survival story with cancer. Does it play into, like, the resilience and positivity that you're always showing me?
That's an interesting question. I never thought about it like that. I think when I was younger, I think I was just more of a generally happy person, maybe till, the teenage years, you get a little cranky and such. My dad used to call me sunshine every once in a while. And so I think I was always a lens of positive. I think where the cancer experience, and Terry, I'll be curious on yours, I don't think I take anything for granted anymore. And I think if I'm in a situation that doesn't work for me, I don't stay in a way that I might have stayed prior to this. Now, I'm 20 plus years out of the diagnosis. So I was in my early 20s when I had thyroid, and my husband likes to say it's a D-class cancer. So, it's not that hard to survive from thyroid if you get the right kind. But I think you still think about, like, you only get one life. So you want to make sure that you are living it in the right way. And most things, you're not going to remember in five minutes, never mind 5 years. I think it's the let's not take anything you have for granted mindset.
Yeah, I
Terry,
completely agree with you. I feel exactly the same way. I mean, it's scary when you get this kind of advanced stage cancer diagnosis, because the first thought is, am I going to die? And I lived a couple of months with that in my head. And I continued on with my life coach from my life coaching program. And she really got me to think about it. And I kept kind of coming back to, what did I do wrong? What is, and going into the past instead of looking forward, as I was talking about earlier. And it is, Melissa, that life is too short. And if things do not serve you, do not stay there. I haven't been like eliminating friends or anything like that.
Men,
But I
those
but I
men.
am hanging out with people who are positive.
Yes.
And I do, and I don't know if you notice this, but there are some people that take your cancer diagnosis almost personally, like it's happened to them. Like people would literally call me and go, well, it really makes me upset that this is happening to you, and I don't know if I could even talk to you anymore. And I'm kind of like, huh? you know, because it upsets them. But I'm not some sick person over here. I'm somebody who's alive, and I will be alive as long as I am alive. You know what I mean? I will keep living. I will
You're
keep moving forward.
you're somebody who's kicking ass, just straight up. Because I gotta ask you about. We have a pop culture section that we do after this, but I still have to ask the running. Like, how have you been able to maintain the the Disney runs and stuff like that?
So, Chris, I decided when I decided, and it was almost a mental shift, that I was going to stop looking back, but I'm going to move forward towards wellness. Part of that was physically as well, right? So I've always gotten joy physically and mentally from running. Now I'm walking a lot more than I'm running right now, just FYI. But I've always gotten joy from that. So if that is something that makes you happy, and I said this on one of my, I don't know if you saw this video, but cancer isn't going to take my life, and it is not going to take my joy. My joy is Disney running. I'm a Disney adult. I get joy out of going and hearing the music and getting my picture with the characters and the whole Disney experience, and so many other things bring me joy. But if I just sat around and didn't do these things because I have cancer, no, I've had to limit. Like marathon weekend, I walked the 5K. I barely walked it. Then a couple
And you're
weeks
doing
later,
this in costume, right?
I did, and then a little costume.
We need a picture. We need a picture.
Then I did a little bit. I did the 5K and the 10K at Disneyland, and then this weekend I did the 5K and 10K, and I left Sunday because I knew that if I stayed, I would attempt the half marathon, and I am not ready for that. But I just was talking to my daughter this morning. In April, they have something called Springtime Surprise, and I'll be doing that. I will be doing the 5K, 10K, and a 10 miler. And I said, listen, I'm going to have to run a little. I have some neuropathy in my feet, so I'm kind of getting used to that. But you can still run. And so that's what I'll be doing. But it's something that makes me happy and it brings me joy.
Well, Terry, I would say this chat has brought me some joy. I know that I will be finding you on TikTok. You'll be one of the 4 other people that I will follow. I have to jet to navigate my daughter through a telehealth appointment, but I'll leave you guys to close it out. But thanks for being the bright spot in my day, Terry and Chris.
Awesome. Thank you.
Setting this up.
Vastly appreciate it. And Terry, and thank you so much, Melissa, for sharing parts of your journey as well. Go and be the light. You were the light on here, but now you got to be the light for your daughter. So we wish you well. So Terry, like for people that have not been to karaoke with Terry or seen her perform, this is real deal vocal cords over here. And real deal obsession and love of music and a lot of other things too, Disney. And that's what we like to get into as well, is like from pop culture or unpopular culture or whatever, arts, whatever. What's been keeping you going for the past couple of weeks? Like what's been on the playlist?
Binging terrible TV, Chris. Because I have had some bad chemo days where, so every day I try to get up to do something, and I try to do something physical. I try to do something mental, and that's not watching TV or mindlessly scrolling. Like, it's listening to a podcast about something or listening to a book or reading a book. So I try to spend an hour or two so that my days are, because I do have some really bad days during the chemo cycle. Not the day of chemo or the day after. It's really like day 3 through 8 are not good. So I'm not looking forward to them because they get worse every time. And some of them I spend in bed. So I love Below Deck and Traders. And
is that the Below Deck? Is that the Star Trek thing?
No.
Oh.
I love Star Trek Academy as well. But that's definitely, me, and and everything I'm seeing is also showing me, by the way, they're going to bring Firefly back. So,
No
yeah,
way.
so let's hope, not going on that. But Below Deck is like sailing a yacht where people can come, and it's all filmed. It's all trash TV, but
Good.
so just some good, because unfortunately when I'm in a lot of pain, it's really hard to concentrate. So I just put something light and fluffy on, and but I love to go to the movies too. I go to the movies every Friday with my popcorn shirt on, get my free bucket of popcorn, and so I've probably seen every movie that's come out, while I've been sick, because I enjoy it.
Beautiful.
How about
beautiful.
you?
One of my favorite artists, they're part of a group called Death's Dynamic Shroud, but it's one of their solo projects. His name's Giant Claw, out of Ohio. And I have just been taking Giant Claw music on my runs with me. And it's just this crazy kind of vaporwave tapestry of video game sounds mixed in with pop sounds, mixed in with he'll even mix Taylor Swift in there. And if anybody hasn't heard this crazy Ohio artist Giant Claw, now's a good time. He's got some great stuff lined up and some cool videos on YouTube.
Cool. Love it.
Fun stuff. Well, Terry, so good. It's we've done some podcasting together. We did a couple of interviews back at Actium or Symphony RM, whatever that company was called. But it's just great to be...
I know. I feel like sometimes I have to think, what is it? I just
great
say that startup.
Yeah, that startup of the past. But yeah, great to be on camera with you, and so glad you got to meet Melissa as well.
Me to do this. It's a little stretch outside my comfort zone, but I appreciate it.
Well, one thing we're gonna do is I just saw from Melissa, she loves Below Deck. Our producer Alyssa, another Below Deck fan. Awesome.
Yeah, but way to go.
But again, that TikTok or wherever you want people to follow what you're sharing, where are the best places for people to keep up with you?
TikTok is probably the best. It's Terry's Cancer Journey. And I always hashtag it cancer sucks, which it does. And nothing, I think now I'm hashtagging nothing's going to steal my joy. Just remember that the thing about hard things in life, they don't have to be the end. They're just sometimes a transformation and a push to get to the next place where you need to be, And that's how I'm viewing this. It's cancer isn't going to make me less. Cancer is going to make me more.
Well, thank you again for sharing. And a reminder, if you can't remember the Terry's Cancer Journey, just type in cancer sucks and she'll probably pop up.
I will.
All right. Thank you so much.